friends, how are you? This is Dr. Srinagi, Ayurveda medicine doctor and also Isha Hatha Yoga teacher. So today in this video we are going to talk about stomach pain. We all have stomach pain at some point in our life, and we all know stomach pain is not a pleasant experience. Sometimes stomach pain is too much, sometimes it is less. But sometimes also this happen after taking medicine, after taking all the treatments, still stomach pain persists, and then the question comes what we should eat, what we should not eat, how to see our digestive fire, what should we do so that this unpleasant feeling in the stomach that should go. So let's see what Ayurveda has to say about it. According to Ayurveda, the most important principle of treating stomach pain is, of course, diagnosis and everything is important. But first thing is cause, Nidan Parivarjan. Nidan Parivarjan means until you remove the cause, the stomach pain will persist. Some big causes, like if we are going to market, street food we are eating, diarrhea happening, so we will know like this street food we will not eat because it causes diarrhea. It's a like but obvious cause. But sometimes there are certain causes are there in food which we knowingly or unknowingly unable to see, and that's why unable to avoid. But in Ayurveda there are symptoms, like what are the symptoms that if the pain is happening because of Vata dosha, what kind of symptoms will come, and if this kind of symptoms will come, then we should avoid Vata aggravating food. If Pitta related symptoms comes in the stomach pain, we should avoid Pitta aggravating food, and if Kapha related symptoms comes, then we should avoid Kapha aggravating pain. So let's go in details about it to understand what are these symptoms so that we can change our diet. It doesn't matter whatever is your prakriti, if the symptom is like that, then you need to balance that specific dosha and that dosha related diet. If your stomach has gas, bloating and constipation, these all are Vata related symptoms. And sometimes constipation also happens excess of heat in the system. But if this pain gets aggravated whenever you eat something cold in potency, then means it is Vata related pain. If you are eating dry food, that also aggravates pain, means it is Vata related pain. If you are fasting someday and after fasting at the end of the day you will feel like the pain is aggravating, that means it is Vata imbalance is there in your stomach that is causing pain. In addition to that, blackish discoloration under eyes and dryness in the mouth, it designates Vata related pain. Not only this, there will be also irregular bowel movements. So for that we take Vata balancing diet. One thing to is what obvious, like tin can packed food we will not eat, freshly cooked food we will eat. We will eat more of the liquid diet, soup diets in our food, and add little bit of ghee in the food, or little bit cooked in little bit of oil. Not excess of oil but organic plant oil. So this way if we are cooking, it is more Vata balancing food. In addition to that, Dashmul decoction, that is very beneficial for balancing the Vata dosha, and always consume warm food, that is very beneficial for balancing the Vata dosha. Now if it is Pitta related pain, if Pitta dosha is imbalanced and that is causing pain, and pain is because of, for pain we need Pitta balancing diet. No doubt you need to take some medicine which is needed, anyway you will take. But for how long you will take medicine? Whole life you will not be able to take medicine. Sometimes you need to remove the cause. So if the pain is because of Pitta dosha, then the symptoms will be blenching, mostly sour blenching, or acid reflux, like acidity or acid reflux, we all understand what it is. Sometimes loose motions with foul smell, excessive thirst, sweat and fever. If it is fever, so definitely there is some infection, you need to go to hospital, take medicine. But even after taking medicine and antibiotic course, if still it is staying, foul smell staying, all the symptoms are staying, and fever little bit vanish, but all the symptoms are staying, then you need to take Pitta balancing diet. If acid reflux is there, Pitta balancing diet. If acidity is there, Pitta balancing diet. Use the coriander leaves in the food, fresh coriander leaves, it is very Pitta balancing. Avoid too much spicy, oily food. You can use mild purge also, mridu virechana it is called, by using trifla churna half teaspoon with lukewarm water after food at night, after not 40 minutes after food, before sleep. So 40 minutes after food or before sleep with warm water or lukewarm water. This will help you to purge gently, and that will balance the pitta dosha. If it is kapha aggravation and the symptoms is related with kapha, then the symptoms will be more of a, like, stomach will feel dull, heavy, and constant pain, constant discomfort will be, and not big pain, just mild pain and constant. Sometimes loss of appetite, nausea, this you will feel, white coating in the tongue, and coldness and lethargy, a lot of lethargy you will feel. And for that you need little bit of ginger tea, eat little bit of spicy food. The powders or churana in Ayurveda, that is called hingvashtak churan from good pharmacy, that you can use, that is very beneficial to enhance the heat in the system, and detox therapies are beneficial. So these are the things which we need to take care if our stomach has pain and if it is related to these specific doshas. So that's all for today's video. Thank you so much for watching, and if you have questions regarding this, please write those questions in the comment section. I will try to answer your questions in the best possible way. And if you are watching me for the first time, there is a subscription button, there is a bell icon. You can click the subscription button, hit the bell icon so that you stay in tune with our upcoming videos. Also, if you would like to support us, there is a join button near subscription button. You can click this join button and you can support us. Those of you who want Ayurveda consultations, please write to me on this given email ID and I will let you know how we can schedule it. So with this note, I would like to say stay healthy, stay blessed, take care. Bye.